Hi, good morning, ma'am. My name is JB Abigail Tarazona, and I will be your nurse for today. How are you? Are you feeling okay? Are you in pain? Can you please state your name and your date of birth? So we're gonna do a postnatal assessment. This is very important in order for you to regain your strength and maintain your health. This won't take too long and this won't hurt. Is that okay? Yes, that's fine. Okay, then let's start. While we are taking for the patient's blood pressure, we should also observe for the respiratory rate. So the first thing that we're going to assess is your breast. So if I may ask, do you feel any pain? Do they feel full or do they feel heavy? Fine, they're perfectly fine. Okay, so let's start. So, panauban nila na yung blanket. Then, next is ang mga scrub para makita ang breast. Okay, so we're in breast. And ang i-assess ang size. Okay na ang size. Ang shape. Are they symmetrical? And the nipple, if they're inverted or then turn out to some heat. Okay. So far, so good. So the next part that I will be assessing is the abdomen. So, ma'am, ipanaugon ko lang ni Danay ha. So that may expose ang imong uterus, and I'll observe if there are any contour, distension, and appearance. So now I will palpate the fundus. So I'll place my hand on the base of the uterus above the symphysis pubis with the other hand at the umbilicus, and I'll press it in and downwards, and I'll try to feel for a firm globular mass. Assess fundal consistency if it's soft or boggy. Now I will start measuring for the fundic height. So in measuring fundic height, place the 0 mark of the tape, measure at the uppermost border of the symphysis pubis or the uppermost border of the uterine fundus. Run the tape measure along the midline of the woman's abdomen to the uppermost border of the uterine fundus. The patient's fundic height is 27 centimeters, which equals to 27 weeks. So the next part that I'm going to assess is for the patient's bladder. So we're going to ask the patient, have you emptied your bladder? How many times have you emptied your bladder? And we'll try to encourage the patient to empty their bladder every 2 to 3 hours. The next part that I will be assessing is for your bowels. So if I may ask, when was the last time you ate and drank? So it is very important that you eat so that you can keep yourself and the baby healthy. Now I will try to auscultate to hear if there are any bowel sounds. So let's begin. So now I will start assessing for the patient's lochia. So I'll ask the patient, when was the last time you changed pad? If she says yesterday, then we have to advise them that even if they feel like they don't have to pee, they still need to get up every 2 to 3 hours and change their pad to avoid infection. So now I will expose the mother's perineum, and I'll try to assess for the color, the amount and odor of lochia, and also try to observe for any hematoma. So this picture shows the 3 stages of lochia. We have the lochia rubra, the lochia serosa, and the lochia alba. We're gonna expose the mother's perineum again and examine episiotomy or lactation for Rita. So we have to observe if there are redness, edema, ecchymosis, discharge, and approximation of the wound. So now I will be performing for the Hohmann sign. So Hohmann sign is a technique used to detect deep vein thrombosis, and deep vein thrombosis are usually common, especially to pregnant women. So we're going to assess for Hohmann sign. Then what we're gonna do is that we expose our patient's legs and her foot. Then we put our hands behind the knee, so diri ang knee. Then we're going to ask the patient, do you feel any pain, any tenderness when I do this? So no, it's perfectly fine. The next, we're gonna dorsiflex the foot and ask the patient again, do you feel any pain or any tenderness? Wala. So the next is we're going to assess for swelling and for heat. Spiyak. So ma-assessment kita. Kamot sa behind sa knee, dorsiflex ang foot. Do you feel any pain or tenderness when I do this? Okay. And assess again for Hohmann sign. Then you're good. Next, ibalik lang. Don't get to the heel. For the emotional status, we have to observe if the mother is happy, if she's touching her baby. And lastly, document all findings. So that is all for my postnatal assessment. Thank you so much!